a person over the age of 60, then you better be careful with your eyes because there are 6 vegetables that you should never eat again if you don't want to suffer from poor vision, cataracts, macular degeneration, and glaucoma. And at the end of this video, I will share with you 3 best vegetables that you need to start eating every single day to improve your eyes' health. So stay tuned till the end. I am an optometrist and eye specialist. I'm an optometrist and eye specialist. Welcome back to my channel. Please like and share this video after watching it. Now let's get started. Number 1. Spinach. It is true that spinach contains many nutrients such as vitamins A, C, E, K, lutein, zeaxanthin, and many others that can help prevent cataracts, macular degeneration, and even glaucoma. However, there is a high amount of oxalates in spinach which can interfere with the absorption of calcium and other minerals needed for healthy bones and teeth. Oxalates also contribute to kidney stones. If you are over 60 years old and already have kidney problems, then you should avoid spinach at all cost. Instead, you should consider eating leafy green vegetables such as kale or broccoli, which do not contain oxalates. Number 2. Beets. Beets are high in nitrates, which can cause a condition called methemoglobinemia. This means that the blood cannot carry oxygen properly and can lead to shortness of breath, headache, nausea, and fatigue. This is because nitrates compete with oxygen for space in the blood cells, reducing the amount of oxygen that can be carried throughout the body. For this reason, older adults who already have lung or heart problems should avoid eating beets. But if you have healthy lungs and heart, you can enjoy beets in moderation. Number 3. Potatoes. Potatoes are a starchy vegetable, and they contain a high amount of carbohydrates, which can raise your blood sugar level. If you are a diabetic or pre-diabetic, then you should avoid eating potatoes because they will worsen your blood sugar control. Additionally, potatoes contain a compound called solanine, which can be toxic if consumed in large amounts. Solanine can cause gastrointestinal problems such as nausea, vomiting, and diarrhea. Although solanine is usually found in small amounts in cooked potatoes, it can be harmful, especially for older adults who may have reduced kidney function. Therefore, if you are over 60 years old, you should avoid eating raw or undercooked potatoes and limit your intake of cooked potatoes. Instead, you can choose to eat other non-starchy vegetables such as broccoli, cauliflower, and Brussels sprouts, which are lower in carbohydrates and do not contain solanine. Number 4. Corn. Corn is a grain, not a vegetable, but it is often treated as a vegetable in cooking. Corn is high in carbohydrates and can raise your blood sugar level, which is bad for your eyes' health if you are a diabetic or pre-diabetic. You should avoid corn because it will worsen your blood sugar control and increase your risk of developing diabetic retinopathy and other eye diseases. Additionally, corn is a common food allergen and can trigger an allergic reaction in some people. The pollen from corn is one of the most common causes of seasonal or hay fever, which can cause sneezing, runny nose, itchy eyes, and other symptoms. People with corn allergies should avoid corn and other related products such as corn oil and corn syrup. Number 5. Tomatoes. Tomatoes are high in lycopene, which is a pigment that gives tomatoes their red color. Lycopene is a type of carotenoid, which is a vitamin A precursor. Carotenoids are also found in other fruits and vegetables such as carrots, sweet potatoes, and pumpkin. However, the body cannot absorb carotenoids very well, and they can accumulate in the body, leading to a condition called carotenemia. Carotenemia causes the skin to turn yellow or orange and can make you look like you have jaundice. It can also cause vision problems such as blurred vision and increased sensitivity to bright lights. In addition, tomatoes are high in acidity, which can aggravate gastrointestinal problems, especially for older adults who may have reduced stomach acid or other digestive issues. For these reasons, you should avoid eating tomatoes if you are over 60 years old and have any digestive problems. Instead, you can eat other fruits and vegetables that are lower in acidity, such as cucumbers, avocados, and melons. Number 6. Eggplants. Eggplants are high in a compound called solanine, which can be toxic if consumed in large amounts. Solanine can cause gastrointestinal problems such as nausea, vomiting, and diarrhea. Eggplants are also high in lectins, which are proteins that can interfere with the absorption of nutrients in the body. Lectins can also trigger an immune response in the body, leading to inflammation and other health problems. People with autoimmune disorders or other immune system problems should avoid eggplants and other lectin-rich foods, such as beans and lentils. In addition, eggplants are high in oxalates, which can interfere with the absorption of calcium and other minerals needed for healthy bones and teeth. Oxalates can also contribute to kidney stones. Therefore, older adults who already have kidney problems should avoid eggplants at all costs. Instead, you should consider eating other vegetables that are lower in oxalates and lectins, such as carrots, zucchini, and green beans. Now that we've covered the 6 vegetables that you should avoid after 60, let's move on to the 3 vegetables that you should be eating every single day to improve your eyes' health. Number 1, leafy green vegetables such as kale, spinach, and collard greens are rich in vitamins A, C, E, and K, as well as lutein and zeaxanthin. These nutrients are essential for maintaining good eye health and preventing age-related eye diseases such as macular degeneration, cataracts, and glaucoma. Studies have shown that people who consume more leafy green vegetables have a lower risk of developing these eye conditions. Leafy green vegetables are also high in fiber, which can help lower cholesterol levels and improve overall health. Make sure to wash them thoroughly before eating them. Number 2, cruciferous vegetables such as broccoli, cauliflower, and cabbage are another great option for improving eye health. These vegetables are packed with antioxidants and phytonutrients that can protect the eyes from oxidative stress and inflammation. They are also a good source of vitamins C, K, and lutein, which are beneficial for eye health. Studies have shown that consuming cruciferous vegetables regularly can reduce the risk of cataracts and macular degeneration. These vegetables are also low in carbohydrates and calories, making them a good choice for those who are watching their weight. Number 3, bell peppers. All colors of bell peppers are a great source of vitamin C, which is essential for maintaining healthy blood vessels in the eyes. Vitamin C also helps the body absorb iron better, which is important for preventing anemia and fatigue. Bell peppers are also rich in other antioxidants, such as beta-carotene and lutein, which can protect the eyes from oxidative damage and support overall eye health. Studies have shown that people who eat more vitamin C-rich foods, such as bell peppers, have a lower risk of developing cataracts and macular degeneration. Bell peppers are also versatile and can be added to salads, stir-fries, and other dishes easily. Overall, incorporating more fruits and vegetables into your diet can help improve your eyes' health and reduce your risk of developing age-related eye diseases. However, it's important to note that while diet plays an important role in maintaining good eye health, it's not the only factor. Regular eye exams, wearing protective eyewear when needed, and managing chronic health conditions are also crucial for preventing and treating eye diseases. Make sure to consult with your doctor or a registered dietitian to determine the best fruits and vegetables for your individual needs and dietary restrictions. Remember to always wash your produce thoroughly before eating and choose fresh, locally grown produce whenever possible. By following these tips and eating a balanced diet, you can maintain good eye health and reduce your risk of developing age-related eye diseases. Eating healthy is just one of the many things you can do to keep your eyes healthy as you age. If you want to learn about other things you can do to improve your eye health, click the video on the screen now. Thank you for watching and see you in the next video.